Well, let's hop to it then. What are your questions?
Yeah, so I think I just wanted to raise a concern about how lockdowns aren't actually addressing the real problem that is that 80% of COVID-19 deaths are in long-term care homes and senior care settings. It just seems like the government is locking down healthy people, making them sick while still neglecting the ones who are vulnerable to COVID-19 by not implementing proper policies to protect our valuable seniors. I had an interview with two of the long-term care commissioner's office staff, and they said that although contracted long-term care staff are limited to working for one home, they are allowed to have multiple workplaces, and those workplaces could be like Costco, Walmart, like anything, which have had multiple COVID-19 outbreaks linked to them, which could also be spread to long-term care homes. And I know, and as we know, it only takes one person to infect an entire home. I personally work in a congregate care setting in Hamilton. And I remember one of the first policies that came out in response to the pandemic was from our CEO, was that if we wanted to continue to work for the homes we were at, we had to sign a contract saying that this was our only workplace. And to me, that made sense. Another alarming issue that was brought up in my conversation with the commissioner's office, in regarding to long-term care, is that agency staff are allowed to work for multiple long-term care homes and are often forced to bring their own PPE, which there's no way to kind of tell if that PPE is clean and uncontaminated. And I find that's a little reckless, just because of the death toll in long-term care. And I understand that there are shortages of staff. I do work at a congregate care setting, so I know a little bit about the problems of that, of being short-staffed. However, I feel like the government should be putting more policies to limit agency workers to one home, because all it takes to infect an entire home is one person. And if that's and if this is about protecting the vulnerable, the government should be at least paying for people to receive the PSW training so that we don't have a shortage of staff in this province. I just read an article on March 9th that CP24 wrote, and how proposals to protect the long-term care residents were rejected as too expensive. Some of the proposals were to ensure that seniors wouldn't be housed housed 3 to 4 to a room during the second wave. And doctors said that the province chose not to hire thousands of additional long-term care staff or place infection control practitioners in the homes as officials did in Quebec. And I kind of find this to not be okay, because there should be no dollar amount attached to someone's life, especially with the amount of lives we lost. I also find it kind of ironic that it's too expensive to protect our valuable seniors, yet the government is continually pouring millions of dollars into helping small businesses survive, that statistically never needed to be shut down during the second and third wave, because those industries had close to zero in percentages of outbreaks in the province, like bars, restaurants, nightclubs, recreation, fitness, personal service settings, and retail. All of these combined are responsible for under 1% of outbreaks. So I guess what I'm trying to ask is with knowing that all it takes is one person to infect an entire home, why aren't there policies limiting long-term care staff not just to working for one home long-term care home, but also having one workplace? And if these long-term care staff feel the need to work for multiple jobs, because of financial instability and for taking care of their families, why isn't the government not paying these heroes enough so they can focus on their job at long-term care, avoid burnout to prevent staffing shortages, and to limit the exposure to both themselves and other staff, and ultimately the vulnerable residents they are trying to protect?
Yeah, so definitely understand. You raised some really good points, and I would agree with you on a number of them, particularly around the long-term care pieces. And I think it's very fair to say that there has to be more done in that space. It's something I've been advocating for years, especially around PSWs, and more training, but also proper pay in order to retain people, and ensure that people are able to be supported and be able to kept safe in those environments. So yeah, I don't disagree with you. I know that the agency issue was a real challenge just because of the shortage of staff, and so essentially the calculus was made that although there is higher risk, it was still more important that people at least had someone able to take care of them than not have anyone, and then not being able to have any care, right? So the potential for risk on the nexus was still low enough that it was considered more important to be able to still have someone able to take care of these seniors. But I think it is, there's failings. It's absolutely something where we've said we need to make sure that people are being supported in these environments, and that there's no stone left unturned. And I think you've raised some really good points.
Are there any policies like that are currently like in the works of just of limiting the staff and like ensuring that they are provided proper PPE instead of like relying on PPE like stuff like PPE that they're bringing in that could be contaminated or been used for like weeks? Because contaminated PPE is no good.
Yeah, and 100%. I understand that anyone who needs PPE, like we've been providing huge quantities of PPE to the care homes, and anyone who needs it should be able to get clean PPE anytime. Like, I'm really shocked to hear that that there's that concern, because it doesn't make a lot of sense from what I've heard, that people would have to be using PPE for extended periods of time. Like, we bought tens of millions and millions of pieces of PPE for all these areas.
Okay. Yeah, I read it in an article.
I do believe you that that's what you heard, but that just doesn't make a lot of sense from what I've heard when it comes to the conversations around ensuring PPE is there. Like, anyone can get it practically. Like, we're giving it out like water.
That's good.
Right? So yeah. I want to hear more about which particular agencies that was, because that's unacceptable if that's the case.
Yeah, they didn't give a particular like what homes they were or what agencies, but there was an article, I think it was on CBC, that mentioned that some of the that a lot of the agency workers were bringing in their own PPE because they didn't have enough.
Right, and if that's the case, like, then we need to address that ASAP. We need to make sure that those agencies are provided with and providing that PPE. No one should have to do that.
Yeah. Is there any policies that can be made to like ensure that there's more inspections on these agencies to ensure that like that's not happening?
Yeah, I understand there are rigorous quality control expectations that are in place with regards to these ones, and that's why, honestly, I'm a bit surprised to hear that, because that doesn't make a lot of sense with regards to, just what I've heard from what we've been trying to do in these areas. So I would definitely want to make sure if you could like pass along the information to me about which care agencies that I follow up with the Ministry of Long-Term Care and make sure that's happening, because that's unacceptable.
Okay, yeah, I'll follow up with you on that.
Thank you.
Another thing that I wanted to bring up is just again like the importance of a cost-benefit analysis being done. I don't know if you've heard, but Stats Canada on March 10th confirmed that as public health measures continued, the number of excess deaths from possible indirect causes from the pandemic became greater than the deaths of COVID-19. And ultimately, like, these are people's lives and loved ones that are being impacted by these lockdown measures, and like that can't be taken lightly. And it just kind of seems like ever since the beginning of the pandemic, there has been there's just been this assumption that there's no alternatives to lockdowns, and the little consideration of the cost of these draconian measures. Balanced risk assessment was replaced with worst case thinking, and Ontarians are continually facing the consequences of that, and will be for generations to come, which is what a lot of medical professionals are saying. And I'm just concerned that the government has bought into this like present bias that makes it prefer immediate benefits rather than sustainable long-term benefits in the future that would prevent more deaths over the long term, which seems to be kind of less attractive. And like I don't want to make the assumption, but to me that it kind of just seems that the government is concerned with re-election rather than just like doing what's best for the people. I'm also kind of concerned with the escalation of commitment bias towards lockdowns, since they were the original strategy, and like in last year, like it made sense at the beginning to lock everything down because we had no idea what we were facing. But now we kind of do. We're a year into this. We have a lot of like science research that has gone into it, and it seems like instead of looking towards more long-term sustainable approaches that don't cause more deaths in the long run, and I find that's a little concerning. From my perspective as someone who's been studying the implications of public policy and how they have and the impact they have on the well-being of individuals and communities, it doesn't seem like much has been done to weigh both sides. And I think the government has a responsibility to do that now, not just somewhere in the future. I'll use the example of the Jim Crow laws in the United States. Of course, it's important that we now look back and recognize the terrible policies the government implemented that caused so much harm and trauma to the vulnerable individuals so that we don't repeat it again. But like, I can only imagine just how much harm and trauma would have been avoided if the government that was in place during those times actually took the responsibility to look at those harms being done and say enough is enough. And I know they are radically different situations, and in no way am I comparing them, but I bring it up just to utter the importance of not relying on future governments to judge past governments' failures. Because if we wait for the future to judge our actions now, it'll be too late, and we are responsible for the actions we take now. Like, it's so easy to look back on different governments and point out their flaws, but it's a whole different, and I'd say admirable thing to look at our own present actions rather than just someone else's past and say, like, yeah, we messed up big time. And I believe that there is grace for that. And, like, I want to say, like, I will be the first to extend that grace. So, like, what has the government been doing in the past and currently to ensure that we are weighing both sides to lockdowns, especially when more and more health professionals are coming out, like, almost daily, saying that lockdowns are, and I quote a family physician's article that says, quote, lockdowns have become more deadly than COVID-19, end quote.
Yeah, so yeah, there's a lot of things to dig in there, and I'd say the biggest piece is just going around the importance of understanding trust and expertise in the structures that are around this, right? So when you look at the structures that feed into the decision-making process, like the COVID-19 command tables, sub-tables, which are a lot of different scientific tables from institutions, people who are working whether in academia or in healthcare or in modeling or in all these different areas. The challenge that you've raised is one that it's not unique to Ontario, but it is a problem in Ontario in that we have a consensus model, right? So essentially what ends up happening in this type of situation is even if there are people who don't agree with where the narrative is, as a government, you have to follow a lane. You can't straddle both sides. And it's easy in practice to say, oh, we have to balance everything out and listen to these people who are outside of the consensus and aren't represented in the medical tables. But you also have to rely as a government on the expertise and advice of the people who are working on those areas. So for example, if you have a number of different epidemiologists and public health experts and people who have been working in that space on, let's say, the modeling table, it's easy for me to say as a 23-year-old MPP with no background in that, I know you guys have said that this is your expertise and that this is what you believe, and we've hired you, like you're part of our structure in order to inform our decision making. But I think you're wrong because I know there's a statement signed by a bunch of family doctors / people from these places, and so I don't want to follow your advice, and I'm going to follow this advice instead, right? So it creates a bit of an unfortunate binary, although I still believe that we've tried to walk a road that's much more balanced than that when it comes to having percentage approaches and having the color-coded approach so that we're not just ubiquitously locked down across the province. And I believe we're taking a far more balanced approach than some other jurisdictions have. And obviously there's going to be others where people would say it's more open than ours is. But I guess the challenge that's raised there is you need to pick the people, you need to pick the advice that you're taking, and you can't switch lanes halfway through and say, I know we were following the health and safety advice of the Chief Medical Officer of Health and our local public health experts and the epidemiologists and the science tables, but now we're not going to. Now we're going to just decide that, you know what, you guys have been wrong, even though we've been listening to you for the last year, and we're going to do things our own way because, we have a YouTube video and a Czechoslovakian statement. I'm kind of being facetious, but you know where I'm going with it. It's extremely challenging to kind of change boats midstream, so to speak.
Yeah, no, I totally get that, but like I see like the models that public health has been like presenting, and it just seems like every single one of them has been wrong. And like I kind of have a problem with like health bureaucrats making every decision. Like disease experts, like I'm not questioning disease experts on like how much they know the disease. Like they know very much about the disease that is being questioned. However, they know very little about general public health, health economics and health policy, and giving them complete control just kind of seems a little irresponsible. Like, I'm in so I'm in.
I wouldn't say they have complete control though, right? Because when you say complete control, what you're essentially assuming is that there's one sort of person who's directing everything. But even someone like Dr. Williams or the Premier isn't directing everything single-handedly. They're taking the feedback and advice that they're getting through the subtables, and they're using that to inform the decision-making. But it's not like there's one person who says, this seems like a good idea, or this doesn't seem like a good idea. Like I'm going to try to pull it up right here. I was in a meeting last week with the Auditor General, and there's a picture. Here, maybe I'll just, one sec, I'm going to send it to you from my internal one. I'm just going to send it to you on Instagram, okay?
Okay.
So you can pull it up there right now if you want. So this is just a list of a number of the subtables. I don't know if you can see it.
Yeah.
Right. So this is let alone all the subcommittees of caucus and cabinet and everything else that is built off of that. So the challenge becomes is all of this happens, and there's part of it I think that's almost overly cumbersome because there's so many cooks in the kitchen, so to speak.
Yeah.
But essentially, what gets through that is the consensus of all of those tables, and to then go and say, I know all of you have spent your life working in this space, but you're all wrong, is very, very difficult. And frankly, often I'm not confident enough in saying that they're wrong. I would say that I agree with you on some levels, but then I just have concerns also with some of the pieces that when I raise questions like the ones you've raised and they give me answers, even if I don't necessarily like the answers, there are answers, if that makes sense. Like the excess deaths one is one I've raised, and essentially they're saying, well, that's under the assumption that there wouldn't have been more of those non-COVID excess deaths if we hadn't had the restrictions in place. And they argued that there would have been more excess deaths as well as COVID deaths.
Yeah.
If hadn't been measures taken to curb it. So I know there was 1,800 excess deaths on top of non-COVID excess deaths, right? On top of the other one. And the argument is, so these deaths have been caused by restrictions. But the reverse argument is, okay, but how many more deaths would have been caused if there hadn't been restrictions, both of COVID and of non-COVID excess deaths? So those types of questions then it becomes a question of trust, right? So like if I'm a CEO of a company or the Premier, I'm not an accountant. I trust the accountants to give me the best advice on what my tax filings should be. Now, ultimately, I'm the CEO. I have to decide whether or not I'm going to follow that advice. But I still take their advice very, very seriously because they are the ones who are trained in accounting and tax filing. I'm not. And so ultimately, even though I'm the one that bears the responsibility for it, I still have to weigh those costs. And I can't say, let's continuing this example, have someone come and say, I know that you think that all your accountants told you should be filing your taxes this way because it's beneficial. But I'm looking at your company and I think that you should be filing them differently. Now, I could, as a CEO, say, yeah, you know what, I think you're right. But then that means I don't trust any of the accountants that I have working for me.
Yeah.
And that's a bit of the conundrum that there is within government.
For sure. And like I totally get what you're saying there. But just one thing I want to bring up is that like Florida has been the least lockdown state in America, and has been doing better than the average state and better than most states, even though it has a very large senior population. And California has never left their stay-at-home order, and has had similar death trends to Florida. And a study from Stanford University came out, and I quote, it says, in absence of empirical assessment of policies, their effects on reduced transmission are assumed rather than assessed. So like my concern is that we've just assumed lockdowns have been working even though they haven't, and there's so many other jurisdictions that didn't resort to lockdowns and have similar trends to the ones who did lockdown.
Yeah, no, I know there's some, but so here's, you're right on some level, but then when I ask that, then they say, well, that's not true. If you look at the situation between those places. Urban centers are very different. We've had, they've had very different turnout in Ontario when you look at the impact of lockdowns in other jurisdictions, because you can always pick jurisdictions, right? So what they'll do then is say, okay, well, look at what happened between Ireland and the UK. The UK held their lockdown, and they didn't have to go into stricter lockdown. Ireland lifted their lockdown and had to go back down because they had thousands and thousands of cases escalate. This is in January. I'm talking going back a couple. But that's a bit of the problem with all of this is you have to pick a lane, and they're often seeming diametrically opposed, right? So if they're going off the examples of, let's say, Australia, New Zealand, and stuff like that, and they're like, oh, we need to be following that model because, look, now they have their whole economy back open because they were able to catch it early and have drastic measures, then you're not looking at California and Florida. You have to look at what your subset is. But you can't, as a government, say, okay, well, if I look at Finland and Germany, they did this, but then if I look at California and Florida, they did this. So I don't know what I'm going to do. I'm just going to throw my hands up in the air and hope for the best. You have to make a decision.
Yeah, for sure.
And then that's where you're kind of taking you're playing Russian roulette a little bit, right? You're in a sense saying, okay, so maybe if we did what Florida did, we'd be fine. Yeah. But there's also a huge risk that we would end up having a situation like Ireland. So now we're sitting here going, do we want to take the risk of looking like Ireland against all the advice of our medical experts? And let's not forget here, right? So Section 22 of the Public Health Act, you would just have local health officers end up going off and doing it on their own.
Yeah.
Even if tomorrow we said, okay, we're going to lift all restrictions, everything's back to normal, they'd say, okay, that's great. Now Section 22, we're going to just literally on a case-by-case basis, you would have a bit of anarchy because you'd have every region with their public health officers putting in place their own orders. Like Dr. Hergy, if we lifted everything tomorrow, would not lift everything. He would just put in place his own orders.
Yeah.
Right? Because he's very cautious. He's very scared, if you will. I have respect for him, but he's just quite, that's his approach to this. Yeah. So there's a bit of that as well, where there's always this push and pull between, I guess, what's doable, what's right, and what's effective. And that's what leads to the conundrums.
Yeah, for sure. It just kind of seems alarming when Stats Canada comes out and says that there's been more excess deaths in response to the pandemic than to COVID-19. But one more thing I wanted to bring up.
Right, but then the response would be, well, that's good because that means we've kept COVID numbers down.
But in a way, it's not good because then other deaths have gone up.
But there would have been more if we hadn't.
But that's assumed, not proven,
right?
With lockdowns.
But the opposite is also assumed.
Yeah. But anyways, one more thing I wanted to bring up was suicide. I kind of wanted to challenge what you said about suicidal ideation has increased, but the actual suicide is not. I've been trained in suicide prevention and intervention, and from my experience, I can say that even before COVID-19, suicide counts are very inaccurate because a lot of people who die by suicide aren't recognized as suicide deaths because the individual usually tries to make it look like an accident. Like, for example, one of the most common ways of attempting suicide is running your car off the road. So if someone died doing that, it would be registered as a vehicle collision. Even though it was a vehicle collision, it's also a suicide death, and that often goes unreported. Another problem with the complexity of suicide and drug overdose is that there's so much complexity in it. And in particular, the increase of suicidal ideation will eventually lead to more suicide deaths given time. For example, as I mentioned in my letter, suicidal ideation is up 4 times as bad as the pre-pandemic. However, even though these individuals might not attempt suicide during the quote-unquote lockdowns, it doesn't mean that that lockdowns weren't the original cause of that suicide and that they won't attempt in the future. For example, I know a father who lost 2 of his businesses and went to kill himself in his cottage, and he left behind his wife and his small child. I worked as a youth recovery support worker, and from my experiences, there's a long period of time, and can be years between when a person first experiences suicidal ideation to an actual attempt. So my concern is that the suicides, they have happened, but much more will, and we haven't seen them all yet. And I'll use cancer as an example. Just because people who are facing cancer aren't dying in the moment, it doesn't mean that they won't in the future. And deaths from mental illness are very similar to that. And also overdoses. Like as mentioned in my letter, that there's been an increase in new users and and heavier increase in people who already used drugs pre-pandemic. And unfortunately, we will not be able to accurately be able to label these suicides or overdose to lockdown because they will most likely continue to rise even after the lockdowns end due to the trauma lockdowns have invoked, especially on young people. And however, I'd argue that there's more evidence to suggest that lockdowns will drastically drive the rates of suicide and overdoses up in the future because the protective and risk factors, and especially when seeing the numbers dramatically rise in suicidal ideation and overdoses, I think we can argue that those numbers are I think we can agree that those numbers are very alarming, and I think it's kind of just like turning our heads to in an irresponsible way to assume that lockdowns aren't a large contributing factor to those increases, especially when lockdowns are done and when lockdowns are making the protective factors more difficult to access and making the risk factors like so much worse.
Yeah, no, I think you're right. We can't ignore that part of it at all. And there has to be, like, for me, I think some of it, even around like the social aspects, it's a difficult balance. I think there has to be a way that we can, especially now that we have these vaccines rolling out, and so the pressures on our healthcare system are diminishing regularly, to see, to see that people's social interactions still aren't able to continue to the same extent is concerning. And so I would say that that's something that weighs heavily on me, and I raise regularly. I don't know that the solution is to just say, okay, well then we go back to life as normal, but I think that there needs to be also that recognition in our actions, and I advocate for that regularly.
Okay, yeah, that's good. Yeah, like I'm not calling for like going back to normal because like I totally recognize that like we're still in like COVID-19 and that it is now an endemic, which means that like we're gonna have to learn to live with this. But like I'm just afraid that we're still gonna be treating this like a pandemic, in the years to come rather than an endemic because like we can't get rid of COVID, unfortunately. Like it's happened, it sucks, but like in a way we have to have more sustainable approaches that don't have such like large economic and social and health tolls to them as well. Like especially with like the amount of like cancer surgeries and other like things have been delayed. Like it's one thing to and I know the government has poured millions of dollars into postponed cancer surgeries, but as much as like it's important that the money is being implemented, like is being spent, it doesn't matter if those surgeries aren't happening.
Right. Yeah. No. Yeah. I agree with you in a lot of places, and I believe I'm always saying like we need to make sure there's a balance there, and that these things are being weighed and considered. And so yeah, all I can say is I promise that I am raising a lot of these pieces, but I do believe there's a time and a place for restrictions in caucus, but there's also an understanding that what happened last fall, that's always a worry where in October, November, beginning of December, there was a number of us that were saying like, we can't go back down, we can't go back into more restrictions, and then it just skyrocketed, and we were forced to in a way that if we had perhaps taken some proactive measures earlier with less severity, we might not have had to go into quite as strong measures. That's a little bit speculative. Ultimately, we won't know. But that's always the thing I struggle with too, right? Is do we want to lift everything and then have to go back down if cases took off too quickly, or are we able to keep a bit of a measured approach that means we won't have to go back into a lockdown? Yeah. I appreciate you taking the time. I am 5 minutes late for my next call. I'm so sorry. These days.
Okay.
Jam packed, but I hope we were able to, kind of chat about this a bit more too, and I appreciate you reaching out and your passion for this, Rebecca.
Thank you for taking time.
Have a good one.
All right, you too.
Bye.
Bye.